Before moving forward, I would like to discuss the concept of axis of movements and line of pull. As you have already discussed in the lectures of general anatomy, by the way, those are present on our website and on the YouTube channel. The movements are along three axes, like for a shoulder joint. Let's take this for an example. This here it provides flexion and extension. It's along the horizontal axis, flexion and extension. Along the anteroposterior axis, there is abduction and adduction, and along the vertical axis, this vertical axis, there is medial and lateral rotations. So, whenever you find yourself thinking about what the function of this muscle will be against these axes in the joint, try to think of the position of the muscles with respect to these axes. For example, let's talk about horizontal axis. Horizontal axis was providing the space for flexion and extension. Any muscle that is running in front of the axis and pulling upwards will lead to flexion. The same will be true for elbow. The same will be true for wrist. The any muscle like the anterior compartment muscle running in front of the elbow on the way to the forearm, they will provide flexion of the elbow. Similarly, the muscles that are pulling upwards running back from the posterior aspect of this horizontal axis, that will provide extension, like the posterior aspect of deltoid in the shoulder region, like the triceps in the elbow region, like the extensor muscles on the wrist region, because all of these muscles are passing posterior to the horizontal axis. Then there is anteroposterior axis. You can it it depends upon, it's a little uh, easy to visualize than to describe. But if we're pulling from upwards, any upward from the outer aspect of this anteroposterior axis, from the lateral aspect of this anteroposterior axis, this will lead to abduction. Any upward pull from the medial aspect of anteroposterior axis will lead to adduction. But please do be very careful regarding the line of pull that is in the opposite direction. Like if upward pull outside can lead to abduction, then downward pull outside can lead to adduction. If upward pull inside can lead to adduction, then downward pull from inside can lead to abduction. And last but not the least, there is vertical axis. This I have found that this movement does confuses the early students, because this movement we are not very clearly seeing as the body part moves. For example, when the humerus is rotated medially and laterally, the humerus does not leave its place. On the same point, it rotates along its long axis. Sometimes when we do that, my forearm is moving out. This movement of the forearm is considered as medial rotation, but that is not the case. It is the movement of, even if I put my arm straight, this inward rotation of this muscle of the bone along its long axis, this is the rotation. Medial rotation when the anterior surface go medially, and lateral rotation when the anterior surface go laterally. So any pull of muscle that pulls the anterior surface medially, this will lead to internal rotation, or any pull that pulls the lateral surface outwards, that both of these will provide internal rotations. Anything that pulls the anterior surface outwards laterally, or posterior surface inwards medially, so these will provide uh, lateral rotation. Thank you so much for listening. I hope so this had been helpful for you. If you have any questions or feedback or suggestions regarding this lecture, please mention down in the comment, and you may reach us through our website. By the way, all the recordings with presentation material is present there, and our Facebook and YouTube channel. Please feel free to reach out. If you have any queries and suggestions, please let me know. I will be trying to follow up with further lectures on the upper limb. Thank you so much.